right. Thank you, everyone, for joining us. Looks like we've got a pretty awesome chat room going already, don't we? Look at this.
I love Fridays.
Page full of chat room listeners.
As Tana would say, hot chatters. We got a page full of hot chatters.
Hot chatters. She's funny. Is she in there? No, she's not in
yet,
the chat
but
room
we
today.
miss her. She adds a lot. And if you guys can ever join us on Fridays, if you hear the recorded version of this, we have so much fun in the chat and get to make some friends and ask some good questions. So
yeah, we have little banners on our website now that during the time that the show is going on, there's kind of displays that we're live broadcasting. So
look at you.
People that come to our website during the time that the shows are on are going to know that we're live. So that'll be fun. Get
good
some
job.
more people.
Good job, Stellman.
Here comes Tana.
Tana arrives.
Here comes Tana.
Woohoo!
All right, everyone. Thank you so much for joining us. We appreciate it so much. Today is, for reference, what's the date today? I don't even know what the date is. Let's see.
June 5th. Do you ever know what the date is?
David Icke told me to lose track of time.
He did a good job. You don't have to try very hard.
June 5th, 2015, and this is episode 380 of Extreme Health Radio. So any links that are mentioned during the show, any books, any websites, anything like that, we will make sure to take notes for you so you can grab those show notes later on at the podcast version of extremehealthradio.com/380. And I just want to let you guys know, too, that you are able now to join our email list and get some really cool bonuses through the use of modern technology, which is pretty amazing.
Wow.
I wouldn't even know how to do this myself since I don't have a cell phone. But if you text the word "Get Healthy" to 33444, you will now be able to get access to my audio program about how I overcame my food cravings, and a really great ebook that sells for $20 on Amazon, and some really cool bonuses for joining us. Plus, you'll never miss a show, too, because you'll get updates on all our upcoming shows and past shows.
Right on.
That's good stuff.
We tried it out on my phone, and it worked.
Get Healthy to 33444. And this episode is going to be commercial-free, so if you would like to support us, we'd greatly appreciate that. This is a little test, and if you want to have the shows continue to be commercial-free, go to extremehealthradio.com/join, and there's lots of different ways of supporting the show. You can support us financially via Patreon or bookmark the link on Amazon and use our Amazon link, or you can send us a donation or shop in our store. But then there's also 7 or 8 different ways you can support us in a non-financial way, too, that really does help a lot.
I would love to give a personal shout-out to our pal Andrew, who we woke up this morning, and he's our newest Patreon per show donator.
Nice.
So, Andrew, thank you.
That is very cool.
Yeah.
Very, very cool. So today we have Dr. Lane Freeman, and she is the doctor who removed my mercury amalgam fillings in 2010. I mentioned that in our newsletter this morning.
That was our first trip to Marble Falls.
It was, wasn't it?
Yeah.
Marble Falls, Texas.
Oh, I love that place.
Her website, along with Dr. Nunley, is healthysmilesforlife.com, and we would encourage you guys to check out that website and make the pilgrimage to Marble Falls if you're interested in getting your teeth done in a holistic, whole-body dentistry type of way, which I think is the only way to get your teeth done these days. So it's going to be an honor to have her on the show. Thank you so much, Dr. Freeman, for being on the show today.
Oh, thank you for having me. I'm so excited to be with you all today.
Oh, I'm so excited as well. And it says here that you've been in this practice since 2002.
That's correct. Actually, I grew up in this practice. Dr. Nunley was my dentist when I was younger, and then I worked for him both when I was doing my undergrad and also on summers when I was in dental school, and then was able to join him. So I feel like I've been here for a really long time.
Oh my goodness, that's so great.
Yeah.
Wow. So you went to him when you were just a young child, and at that time was he practicing holistic dentistry?
At that time, Dr. Nunley has always been very aware of health issues and has always done things with healthy smiles, healthy teeth, healthy body in mind. However, at that point, he was still not, the practice wasn't considered a holistic biological practice at that time. Mm-hmm. In fact, when I joined him, even in 2002, prior to that, he had still been performing many, many root canals every year, didn't place mercury fillings, but removed them without any kind of protocol. Mm-hmm. And so all that changed, though, shortly after I joined him. So pretty much the whole time that I have been practicing, I've been able to practice in a more biologically aware manner.
Now, for people that don't understand, I believe personally that the dentistry should be one of the first places you look at, even if you have stomach issues or if you have any sort of health issue whatsoever, I think that the mouth is the first place to look at. But a lot of people hear that and they may think, what the heck does your teeth have to do with the rest of your body? Explain to people a little bit about how that whole thing works, the holistic dentistry, and how it affects sort of the rest of your body.
Okay, yes. So it is, what's great is that people are now, like you, becoming more and more aware of the connection between the mouth and the rest of the body. For so long, really, it felt like your health kind of was, your mouth was one thing and then the rest of the body was unconnected, and vice versa. Mm-hmm. And what we've really found through lots of research that's been done in the past, but then also is being redone now, is that it's all connected. The mouth is just the gateway to the body, and so everything that's going on there is going to affect the rest of the body. And then we also see systemic illnesses showing up in the body as well. So, for example, when we've changed the way we practice, it means that anything that we are doing in the mouth, whether it be filling just a regular cavity or looking at infection in the gum tissue or around a tooth, we're wanting to make sure that whatever we do, we're aware of how that's going to affect the rest of the body. So whatever materials we place in the mouth for a filling or a crown, we want to make sure that those are going to be biocompatible for that individual person. Mm-hmm. And also the way we deal with infections. So, for example, we don't want to throw a lot of harsh chemicals at an infection if it's just going to take care of it there, but then cause some other problems with a patient for their systemic health. Mm-hmm. Also, leaving infections in the body, in the mouth, can be a big problem for the overall health of a person as well.
So, yeah, people that have root canals or infections that are sort of systemic cause, over time, I would imagine, some sort of issues in other parts of their body which they never would have connected.
Correct, because it can be, what you have to think of it as is it's all these little insults to your overall immune system. So even a small infection that sits in the mouth for a long period of time, your immune system is constantly responding to that. And, the body has to take a lot of insults just from the world we live in anyway. Mm-hmm. And then if you add in there something that's right there sitting in the bone that gets ignored, then you can really create some bigger problems without even realizing it. What's great now is that so many more people are getting educated on their own, but also physicians and chiropractors and other holistic practitioners are starting to realize, hey, I've got to look in the mouth. They may not know exactly what they're looking for, but they know that they need to send a patient to have a good evaluation on what's going on. Is it metals that can be affecting them? Like you mentioned, and I know we'll talk more about root canals, all of those things that can affect the immune system, affect the body's ability to heal, to handle other infections and things like that.
I wonder too, I'm curious, I wonder if there's ever been any tests done to know whether or not how much of the immune system is suppressed as a result of, like, say, something like a root canal. I wonder, is there any way of knowing that, or is that even impossible to know how much the immune system is suppressed by that?
Well, you probably couldn't have just one single test simply because everyone is pretty different on how they respond to things. Everybody's pretty individual as far as what all their immune system is dealing with. Mm-hmm. For one thing, there are genetic tests that can tell you if you have a certain gene that is a certain subtype of that gene that makes you more susceptible to immune system malfunctions, or if you have a harder time detoxifying from either heavy metals or from infections. You just have, your body's just is already going to have a predisposition to having a harder time with that. And so, but testing exactly how the immune system is affected by, maybe one root canal would be a little more difficult because it would have to encompass so many parameters.
Yeah, that's true. Yeah, I guess, because each person is exposed to different toxins either in the home or environment. I guess that would be pretty impossible, wouldn't it?
One test that we are able to do on an individual basis, though, is when we do remove root canal teeth, we are able to send that particular tooth or even a sample from the socket where we just removed that tooth. We can send that to a lab for DNA testing, and what that tells us is exactly what type of bacteria were populating that infected area, and it lets us know what your body was having to deal with. Now, of course, we've removed that and we've cleaned that area out, but it does give us an idea of what type of bacteria were affecting the body in that way.
Yeah, that's really fascinating. Actually, when I was there in 2010, you would remove my mercury in 2010, and then just our recent trip to you guys, Dr. Nunley had done the root canal on me. I think he removed 2 root canals, and Kate, he had one for you. And on mine, he did that exact blood work, and I'm trying to find the little PDF document as you said that what was found, but it was like these terms. It just scared me to death. Let me see. It's just crazy.
We do always tell the patient when we hand them that report, because it can look a little scary when you're looking at those that crazy names of those bacteria, and then when you read the descriptions and where they're other places they're found and what infections they can cause, it can be a little scary, but it shows you just how toxic root canal teeth can be. Even if they're not symptomatic, even if they're not hurting. People tend to think in the mouth, well, if it's not bothering me, then there must not be a problem.
Right.
And that just, unfortunately, simply is not the case. It's very similar to heart disease. Just because it doesn't hurt doesn't mean that there is nothing going on that the body's having to deal with.
Well, I'm a definitely walking, living, breathing example of what happened, because I had this infection on my hands. It was the weirdest thing. For people who want to look at it, they can look on I think it's on my blog, but I've posted pictures of my hands. I had these kind of boil-looking, bizarre growths starting to take over a lot of my different, like, what do you call those?
You're just on
my
your
joints.
Joints.
Yeah, it was bizarre. And the minute I got my root canal tooth taken out over with you guys, and within 2 weeks, I'm not kidding, they had shrunk to half their size, and within a month, they're completely gone. And it was one of those things that I never would have correlated that to a root canal infection. And, I'm sure some people get their root canal teeth or their cavitations dealt with and start feeling better, but to actually see it, it was the most probably. And
you had tried to do this. You tried to get rid of them multiple ways.
Oh my gosh, 5 years. I tried to burn them. I tried to, you'd think it's a dermatological kind of an issue, but when you start linking that to your teeth, it's pretty eye opening.
It's bizarre, yeah.
Yeah, we've stopped saying that there's no way something could be related to either mercury fillings or metal that's in crowns that contain nickel, or root canals. We've stopped saying that because we've seen so many people with stories just like yours, Kate, where they actually had a change fairly quickly afterwards. And we also know that even somebody who doesn't have something as drastic as you had, what we see a lot, though, is that what we're doing is we're removing a major drain on the immune system. We're removing, whether it be with the mercury fillings or a root canal tooth, whatever we're talking about that we're looking at for each individual patient, we know that we are creating health. We're taking away something that is a constant irritant to the immune system, and that can only be good.
Right.
Yeah, a lot of people are going to see some immediate responses. I just found that PDF, the version of that report, and it's interesting. There's something on here called, it says anything that's 9.0 or greater. Let me take a look at this. It says 9 or greater indicates a serious risk, but greater than 7.5 indicates a less moderate risk. And mine, I had a serious risk with a Peptostreptococcus micros, and it says here that is an anaerobic gram-positive, slow-growing, non-spore-forming bacteria with increasing resistance to antimicrobial drugs. It is a commensal organism living predominantly in the mouth, skin, gastrointestinal, vaginal, and urinary tracts. And the symptoms are, under immune-suppressed or traumatic conditions, Peptostreptococcus micros can become pathogenic. The organism can cause brain, liver, breast, and lung abscesses, as well as generalized necroticizing soft tissue infections.
Wow.
And that was in my root canal.
that was in your root canal too.
Yeah. My goodness. I thought I was healthy too. Wow. Isn't that amazing that these things live in our mouth? And like you said, people have no idea because you can't feel them. You can't see them. You can't really know they're there,
Yeah, that we see some really interesting things on those reports as far as the types of bacteria and the infections that they can be associated with. And of course, like you just read, we always are like, no, remember, we took that out. That's not still in your mouth, but that is what your body was dealing with. And, there's so much great research that shows, and I know you looked at that as you were deciding to have your root canals out, that shows that the reason why root canal teeth are so toxic is because you never can clean all of those little canals out. If you've ever seen a root canal on an x-ray, it looks like just the main canal is cleaned and filled. And many endodontists, root canal specialists can do a great job at that. But what you can never get is all the little accessory canals. There's literally miles of accessory canals within just one single tooth. If you were to shoot some dye through it and slice that tooth in half, it would look like a road map in Texas with the number of accessory canals. And so that's where all those bacteria love to hide and live. And you've taken away the main blood supply. So now they are just having a heyday in there, just creating their toxins and expelling those out of the tooth. So
no, go ahead.
I have a question. Why don't typical non-holistic dentists not go there? I mean, do they think there's no point in going the extra mile to clean out all these little canals or take those out? Or why doesn't everyone value that?
If they could find a way to do that, I'm sure they would. Many very conscientious root canal specialists and even general dentists that perform root canals, it's the fact that they're going in about 20 different directions. You could never have an instrument that could get all the way through all of those to clean them out. And even new techniques where they're shooting things like ozone or other medications down into the tooth with the hopes that it'll kind of expel out into those accessory canals. Some of those are microscopic in nature. Some of them you could see with just the naked eye, but they go off maybe at a right angle or some of them even go back up the tooth away from that main canal. And so it's just not physically possible to clean out all of those canals. The other thing that you have to remember about a root canal is that once you have taken out that main chunk of that nerve, you've now created a dead piece of tissue.
Yeah.
And so we know that anywhere else in the body, that's not compatible with life. We know that if, you have an area anywhere else internally or even externally, an area that dies, we know we have to cut that away. And so when you go back to thinking about that in the mouth, we're leaving something dead, something that was a living structure, living piece of tissue in your body, and now it's dead. That's another reason that creates a problem with root canals, leaving them in the mouth.
Now, these canals, are they associated with the tooth? Are they in the tooth itself, or are they part of like the root system that you pull out?
They are, that's all one piece, but it is in the root structure that's down in the bone. So if you think about if you've seen an x-ray of your teeth, the part that you see in your mouth is up above the gum line and up above the bone. And then the root is down in the bone. So all of that canal structure is down in the root, which is down in the bone.
So when someone does a typical root canal, what exactly are they doing? They're leaving part of the dead tooth in there and they're killing the nerve. Is that what goes on?
So if you think about, once again, the tooth that you see, the part that you see in the mouth, they would go in through that part and access down into the root.
Okay.
And there is an open space in the middle of your tooth. That's called that's where your pulp lives. It's called the pulp chamber, and then the nerve canal. And that's that main canal that goes down the middle of each root.
Okay.
And so that's where they're going in and cleaning that out and then putting a filling material. It would be great if then outside of that canal in the rest of the root, it was just absolutely solid, but that's where all those little accessory canals is outside of that.
Okay. And so what happens is that the tooth is essentially dead when it's in the body as a root canal, and they put something over the top of it to make it look like it's a nice, healthy, shiny looking tooth.
Exactly.
And then it just sort of rots there, right?
It sits there, and that bacteria just populates that area. It's just no longer living. It doesn't have a blood supply or a nerve supply to it that's anything, significant like an alive tooth would.
You know what's amazing is I've been hearing on just regular radio stations over the past few years, just regular, like in here, in LA, it's KFI and things like that. And you can hear them talk, and they'll talk about how heart disease is related to your teeth and things. And it blows me away that this is actually starting to become more mainstream, where people are starting to connect the dots between oral pathology and issues with specific teeth and heart disease or cancer, things like that. It's pretty cool. It's pretty cool how people are waking up.
Yeah, people are really becoming educated. And what's interesting is that a lot of this is very patient driven. patients are asking more questions, which then causes the physicians and the other and dentists to become more educated themselves and to look outside that box. When we're in dental school, we're taught that root canals are just fine, mercury fillings are just fine. And so if you don't look outside that small field of research that they're showing you, then you just kind of keep going down that track. And we're taught it's just almost barbaric to take out a tooth. You should save a tooth at all costs. That's why you should definitely have a root canal and then have a crown and those kind of things. And so when you shift that and you look at some research that's outside that very narrow window, and you look at the research that's been around for a long time, done by Weston Price, who did the initial research on the toxicity of root canals, and that has now been recreated and followed up on. When you start looking at that, you go, oh, there's so much more info I have to look at to make sure that I am taking care of my patients properly and not just focusing on how do I fix this one tooth.
Right.
Because you might be saving a tooth, but at what cost?
At what cost, yeah.
Well, this is interesting. Just 2 weeks ago, my own sister, I feel so bad, but she went and got 2 root canals. She only told me she was actually getting 1. And then I spoke with my mom later and she goes, oh no, she had 2. And I think it's because I had tried to warn my sister a little bit prior to, I said, listen to this show, listen to this, check this out. And unfortunately she didn't take the time. But, I was saying my own experience, what had happened, it was so much better for me to have that tooth extracted altogether than to try to go to these heroic, ways to save it and things like that. Would it have been better for someone in her case who doesn't value what we value to have the teeth extracted by a regular dentist than to keep them in and try to do the crowns? Or is there just a totally wrong way to extract those teeth that it would have been worse off for her to have those done at a regular dentist? Mm-hmm.
Well, one of the things that we've become very aware of in extracting teeth is that once you extract the tooth, you really have to go back in and clean out that socket. First of all, to make sure that there's no infected bone tissue that, as that bacteria excretes their toxins and they kind of leak out into the bone around the teeth, you want to make sure that you clean any bone tissue that's become infected. You have to clean that out. And then also you want to make sure you remove the ligament that surrounded the tooth. That's what attached it to the bone in the first place. So that you've got a good clean slate for the body to begin filling that in with bone. And that's just not the way we're taught to do it in our traditional training with dental school. So if you've never been taught differently, then you would just take the tooth out. Now, I would still say it would be better to have a tooth taken out than have a root canal in most cases.
Okay.
But you do run the risk if you don't clean it out properly. There is a possibility that you could develop what's called a cavitation there, which is an area of the bone that doesn't heal in properly. And so you leave a dead space in the bone, an area that has some dead bone still in it that can create an environment for bacteria to sit in there, just like a root canal tooth does as well. And so, I have to back up just and make sure I say, as far as root canals are concerned, not everyone who has a root canal is going to develop an autoimmune issue or a cancer or anything like that. Everybody's immune systems are different in that I do have some patients who are 80 years old and they've got 6 root canals and they've never spent a day in the hospital. They've never been on any medications, and their immune systems just happen to be such that they handle that just fine.
Wow.
Yeah, it's funny you say that, because there are some people commenting on, we turn our radio shows into YouTube versions of them, and people comment, and it's interesting. People that comment, for some reason, people that comment on YouTube can be very, I don't know, they're much more, I'm not sure what, but they're not as nice when they're on YouTube for some reason. I don't know what it is about YouTube. But someone on YouTube said, to one of our previous guests, I forget who it was, but they said, I've had 12 root canals and I'm doing just fine. This guy is a complete quack. Mm-hmm. And it's interesting because just because it is the case for you doesn't mean that's how the human system works on a general level, right?
Exactly. And that's the biggest part of practicing biological dentistry, is that you recognize that every single patient is different. Every single immune system is individual because of all of the things that it's faced in the past, your genetic dispositions, all of those things. So you have to look at each person differently. And I always give my patients all the information on both sides. If you have an infected tooth, you can do a root canal or you can have the tooth extracted. Here's the pros and cons of both of those things. Mm-hmm. Very rarely do I have a patient that chooses to go ahead and have a root canal, but there are some patients who just say, I just can't stand the thought of losing a tooth. Now, there are a few of those that I end up seeing a couple years later, and the root canal tooth has become infected, and we end up taking it out anyway. Mm-hmm. Or they come back and it just never has felt right. But I also have some patients who have been in their mind, they've had no symptoms, everything is fine. Now, if we extracted one of those teeth, would I find some bacteria? Most definitely, but they could be of the type that their body can handle that, so they do just fine.
Yeah, it's really fascinating. This experiment that you mentioned before with Weston A. Price, didn't he do some really interesting experiments with rabbits or mice, and he pulled the some tooth from one rabbit and put it into underneath the skin of a different rabbit, and that second rabbit ended up dying of the exact same infection that the first rabbit had or something?
Yes, he did that. He also, that was correct, it was with the rabbits, and he could recreate whatever disease was in either the human or the rabbit that had the root canal treated tooth. He could recreate that, I believe 100% of the time. Wow. Could recreate that same thing all the way from heart disease, heart attack to diabetes, those kind of things. Now, that's not to say that a root canal can be the only cause of those things, or if you have a root canal, you're going to develop one of those. But it's a major contributing factor because of the bacteria that are in there. But that's what his research showed and it was a very, very interesting way to do that, but just placed the tooth under the skin of the rabbit and could recreate the disease.
Isn't that wild? So what's going on there? Is the infection traveling through meridian lines of the body and sort of, because I've heard that the teeth, each tooth corresponds to a particular organ of the body. Is that correct?
If you've ever seen a meridian chart, which you can Google one of those but if you see a meridian chart, and if it's specific to teeth, you'll see it'll be a chart, and above each tooth, it's kind of this chart above each tooth will have the corresponding organs that are on that. So whether, for example, your premolar teeth are on the breast meridian. So they have there's a lot of research going on right now with root canals that are done on premolars in females and correlating that with that meridian and with root canals and breast cancer. So there's a lot of interesting research going on right there with that.
We had a doctor on a while back. I refer to him quite often. He's from Ecuador, Dr. Bob Dowling. And he does this radio ablation for treating women with breast cancer. And he also treats a lot of different types of cancers as well. But he's a holistic dentist as well, practicing down in Ecuador. And he's been able to look at the x-rays and show, I'm not sure what it looks like in the x-ray, but there's an actual path that goes from a particular tooth all the way down through the neck, through the collarbone, and all the way to the exact location of where the tumor is. It's like a line that goes from the tooth to the tumor through one of his special x-rays. And it's just amazing that stuff like that is out there, and there's connections there, but you have to really sort of dig and find a biological dentist or find someone like you guys that are doing this kind of work to really get this kind of treatment. Yeah.
Yes. The good thing is that, like we've mentioned a few times, people are becoming more educated, so they are digging more, and and it's causing more and more dentists and physicians to be available for people, which is great. We have a really specific, protocol we follow when we're doing either removing root canals or removing mercury fillings, or really doing rehabilitation on the whole mouth when we're trying to clean things up and remove anything that could affect the immune system. And so we get a lot more calls of dentists saying, hey, I've never really heard about this, but I want to learn more. Or, hey, you saw one of my patients. Can you tell me, why you did this and that? And so it really opens up a lot more dialogue for education so that we can move forward instead of continuing to just do it like it's always been done. Yeah. But really encourage others to move forward and get patients to ask questions and be responded to well.
We have a question for you. Speaking of questions in the chat room, our friend Evan says, what does Dr. Freeman think of EDTA post-mercury removal? Do you have any thoughts on that?
I do. So there's kind of two schools of thought on that. One is that it's great. The body needs a little help with releasing those metals so that your body can eliminate them. The other thought is that sometimes that EDTA dose is a little harsh on your body, and it causes you to release too much of the heavy metals out of your cells, and then your body can't get rid of it fast enough, and that some of it just gets soaked back up. What we always tell patients, we don't administer that in our office, but most of our patients that are doing that are under the care of a holistic physician or a chiropractor or someone that is watching them, monitoring their recovery and monitoring their detox. And so with that, we've had many doctors that have said they feel like the body has to have that little bit of an extra boost. So as long as all the mercury is out of the mouth, and someone's being watched and monitored by a physician, then we're happy with that. I think we've seen some really great results on somebody who just couldn't quite get their body to detox as quickly as they wanted. So the flip side is just being careful. And if you're feeling like you're detoxing too fast and it's making you feel bad, the EDTA might be something you back off on.
Okay.
So a few minutes ago, you mentioned that you have specific protocols for. Let's talk a little bit about the mercury fillings. You removed mine in 2010, and you go through this whole procedure, and you showed me on the microscope, all the bacteria and what's compatible with my mouth and my teeth and all these things. If most people have mercury fillings, or a lot of people do, and they're considering going to a dentist, preferably a holistic dentist if they can't make it to you guys and they want to go to one local. What are some of the standard procedures they should look for if they're going to go somewhere and get their mercury fillings removed? Okay,
so that's a great question. So one of the most important things when you have mercury fillings removed is, if you've ever sat in the dental chair, and obviously if you have mercury fillings, you've heard the sound of that drill as it removes, a cavity or an old filling or something. And, there's a lot of water and a lot of air and material that's in there. So one of the worst things that can happen is if a mercury filling is removed and there's no barrier there's no protection for the patient, they swallow lots of pieces of mercury, but they also inhale the vapor that is created as that filling is removed. And so the most important part of our protocol is the protection for the patient with the use of a rubber dam. So that would be the first question I would tell someone to ask their dentist, is if you're going to remove my mercury fillings, are you going to protect me in any way with a rubber dam, which is basically just a little sheet that is stretched over the teeth that you're working on, and it isolates them from the rest of the mouth. So it provides a barrier that keeps you from swallowing or inhaling any of that's coming off. In addition, in our office, we additionally, many times if we're taking out multiple fillings, we'll put an additional barrier behind that has, not only is it a physical barrier, but it also has built-in suction. So we're just creating one more layer of protection for the patient. Some of the other things that are really important are to use a lot of water so that everything is directed into the high-speed suction, so that everything is coming out of the mouth and nothing is staying in the mouth for the patient to swallow or anything. The use of high doses of vitamin C, preferably with an IV. We use 50 grams most of the time. It is dependent upon the patient, but that's the standard dose. And you can really only do that if you're doing that IV. It would cause too much digestive upset to do that orally all at one time. But if we can do it IV, that was ideal because that vitamin C helps your body produce some more glutathione, which is going to help with the detox. It also is a great boost to your immune system. And if we're adding any surgical procedure, it helps with healing there as well. Other things that we have in our office are a negative ion generator, which is blowing a constant stream of air right over the breathing space of the patient, just one more way to clear the air. And we also have a little external, we call him Snuffy. It's just an external vacuum system that is also sucking the air away from the patient's breathing space just to keep that as clear as possible.
Wow, it's incredible that you have to go through so much just because of this mercury. But mercury really is that toxic. You got to really do all these things, don't you?
Yeah, we want to just protect the patient, because it would be worse to take out. I've had a few patients say, they'll call and say, well, my dentist says he won't use a rubber dam. Well, then don't have the filling taken out, because you're just going to get such a huge dose of that mercury vapor if you don't have any protection there.
Wow. And what people don't realize, too, is that if they eat foods that are particularly warm, right, doesn't that off-gas the mercury in their mouth or in their teeth?
It does. It does. What you have to know is that there is mercury vapor coming off of those mercury fillings pretty much 24/7. So then if you add any heat, like from coffee, and then drink something cold or eat something cold, you have an expansion and a shrinkage of that metal on a small level, but also any friction just from eating is going to show that mercury vapor coming off. An interesting video, if you kind of want to see a visual on that. And I'm sure Dr. Nunley has probably mentioned this before, on the IAOMT website, there is a video that you can click on. It's called the smoking tooth video. And it shows a tooth. It's a tooth that had been extracted, and it has a mercury filling that had been in that patient's mouth for, I believe it's like 30 years. And so they take a pencil eraser and they just rub it across the filling just to simulate chewing. They're just the friction that occurs with chewing. And then they have that behind a black light, and you can see the actual smoke just coming up off of the tooth, the vapor coming up off of the tooth, just from that small amount of friction there. And that was just for 10 seconds versus a whole lifetime of having that in there. So that's a good visual if someone wants to really see what that looks like.
Wow. We'll put that in the show notes. I've seen that before.
Have you seen it?
Yeah,
I haven't seen it.
Incredible video. That's amazing.
That's alarming.
Yeah. Wow. And so the mercury just sort of off gases based on, your chewing and the temperature of the food. And then it's sort of being inhaled into the lungs. That's probably where it's going, right? It's
inhaled, and it also is absorbed into the tissue as well. So, you're getting it in a few different forms there. And
it goes into the tissue. What tissues does it go into typically?
The soft tissues, like in your mouth, as you inhale that, your tissues of your mouth are very absorbent. And so that's why you can put, a medication under your tongue and have it dissolve, and it's in your system, in no time. So the mercury is the same way as far as the vapor goes.
Wow. So that's why you have that. What do you call that? Vacuum?
The rubber dam?
Yeah.
The
suction?
The suction, we call it snuffy just because it has a long tube that, looks like the snuffleupagus from Sesame Street.
How cute.
Please get the snuffy for me, please.
Yes, it's very professional.
Wow. And so you put that, so you do all those things, and I'm sure you don't have many patients that have a reaction to the mercury being removed because of that.
That's correct. All of those things are meant to keep patients from having a major overdose of mercury. I've had many patients that would tell us that maybe in the past they had some mercury fillings removed before they were either aware that there were protocols or their dentist wasn't aware, and they will actually say that for days after they felt like they had the flu or they developed some odd symptoms that were unexplainable, in any other way. And it's just that their body just sucked up so much mercury all at one time. It doesn't happen. That's once again, it doesn't happen to everybody. There's definitely people that have mercury fillings out and they don't have any noticeable reaction, but you have just had your cells suck up a bunch of mercury.
Wow. Back in the day, I heard Dr. Oh gosh, what is his name? The father of biological dentistry. What is his name again?
Hal Huggins?
Hal Huggins. Yeah, he was saying that one atom of mercury is more than the body can handle, which was pretty extreme. But if you assume that's true, are there any other things coming down the line in terms of technology that you're excited about that will help you guys make or allow the patient to be exposed to even less mercury during an extraction?
We're always on the lookout. Like I mentioned, because I don't even think when you were here, Justin, we even had that additional barrier that we use in the back.
That's why I've been acting crazy. That's why I've been nuts.
That's what's wrong with you.
I always wondered.
And so that's another, we're always looking for ways to protect the patient. How can we drape their their face or their breathing space. How can we protect them even more? So we're always looking for things. So that additional barrier we use right now is called an isolite, and we can put that behind there, and it helps even in rinsing and everything to keep anything from going down their throat to their windpipe or swallowing, anything like that. So all of those things are just exciting ways that we can keep patients protected. But just as you mentioned with Hal Huggins, he's who developed the protocols that we follow. He developed those himself, and that's what most biological dentists have adopted at least part of his protocol. We use the whole thing and really try to make sure we're using every layer that we can. But he is who developed those protocols.
What an awesome guy to bring this forward, because prior to him, I'm imagining not a lot of dentists were awake and aware to this other than Weston Price and maybe some others, but it definitely wasn't mainstream until he brought it to the forefront.
Yeah, well, he definitely made a lot of sacrifices in order to bring this information forward and to make sure that it was always in front of people so that they could have the chance to really be educated. So.
Yeah, he definitely did. Hey, I want to ask you about stem cell regeneration of teeth in just a second, but I just have one more question sort of along the lines of these types of things. When I came to you in 2010, I feel like I just learned new information about so many different subjects every single day. It's just a fun sort of journey. But back then, I didn't really know nearly as much as I know now. And even when we saw you, I think a year ago, I knew way less. But are there things people can do if they want to come and see you, or if they're going to go to a local biological dentist, that they can do to prepare for their maybe their surgery of a root canal extraction or getting their mercury fillings out? Are there things they can do? And then if there are things they can do, are they different based on whatever procedure they're going to have?
Well, there are. If they are coming to our office, we have patients come from all over the country and all over the world, and we're just blessed to be able to see so many different people and take care of them. If they're trying to come to our office, we usually have a phone conversation with them and have them send some x-rays so that we can get an idea of what they have going on before they make the journey to see us. And many times they'll ask that same question, what can I do before I get there? It is dependent upon, are we going to be doing any surgical procedures like taking any infected teeth out? Or are we just doing replacement of some mercury fillings? Many times, if we're working with fillings and we want to be sure we have biocompatible materials to replace them with, we'll encourage them to go ahead and do the biocompatibility test, which is a blood test that we can send the packet for. Also, just making sure that we're going to be really interested in what their entire health history is. Sometimes a patient will sit down. Our new patient exams are usually about an hour and a half to 2 hours, because we're going to spend the first length of time just visiting about your medical history. And a lot of patients will say, gosh, I didn't know this even mattered. I'm telling you all this stuff. I didn't know this mattered for just to have my teeth worked on. And you have to back up and say, no, this matters a lot. I need to know everything that's happened in your medical history, because you never know how things will tie in and how they can affect it without you even realizing it.
Because everything really is connected. I mean, the people think that, like we're saying at the beginning of the show, I've got this knee pain, or I've got this sore joints, or I've got the XYZ, I got this weird twitching in my eye, or some, soreness in this part of my abdomen or something like that. But if people have oral pathology and sort of these infections going on in the mouth, I mean, I think it would be the first place to look, wouldn't you?
It is. We just really encourage people to not ignore that what's going on in the mouth can affect the rest of the body. You mentioned earlier about heart disease and the link there with the bacteria that's found in the mouth. That's a direct correlation. When they have done the autopsies on someone that has died of heart disease, the bacteria that they find in the heart, in the actual heart, in the vessels and in the heart muscle, is directly correlated with bacteria in the mouth from periodontal disease or from periapical infections, those kind of things. And so there is such a correlation. We always want to be really careful that we're not trying to tell patients, hey, just because that you have this problem in your mouth, so therefore you have this it's the direct cause of this, but it's all is contributing factors. And, somebody can be going along just fine, and then one little thing kind of tips them over the edge, because it's kind of like a glass that's completely full. Your immune system is completely full, and then one little thing can kind of tip you over the edge. I hear every day, I was so healthy until this, and then all of a sudden this, and this. And so, as I mentioned earlier, anytime we're removing toxic materials from the mouth, cleaning up periodontal disease, getting that area, the supporting structures all back into a healthy state, removing infected teeth, those kind of things, we're doing nothing but helping the immune system by removing a burden.
I have a question, if I can clear my voice here. It's a little off subject, but how do you, because you're observing people's mouths all the time, is there a big difference between people who eat a ton of sugar and who don't, if they're honest with you, with the condition of their mouth?
There is. A lot of times I would say 90% of the time you can identify who eats a lot of sugar, just because they're going to have decay every time they come in, and usually their gum tissue, they just, no matter what they do, even if they take really good care of their gum tissue and they brush and floss and all those things, their gum tissue tends to bleed a lot, just because from a dietary standpoint they're not getting all the nutrients they need. But just once again, to the testament to how much the body can take is, I have some patients that just happen to, their body handles that, and they come in and they've just got great teeth and they have a terrible diet. But more often than not, yes, you can tell that there's a lot of sugar in the diet. And many times I'll have that sugar is coming from a source that they don't even think about. They're like, oh no, I don't eat candy, I don't do this. But they have maybe a sweet tea on their desk all day, one of those huge, from the gas station size gallons of sweet tea on their desk that they're sipping on all day, or from sports drinks that have sugar in it that people don't realize. Or things like that they're not thinking that they're getting that sugar content from. And so, one of the things that we use, you mentioned that we showed you your bacteria from a microscope. That bacteria that we're looking at there, it would be different from the bacteria that was in your DNA report from your root canal treated tooth. So you mentioned the word anaerobic. So what's scary about the bacteria that are found in root canal treated tooth is that they're anaerobic. They don't they don't function in oxygen. And so those tend to be very toxic and really have some serious toxins they put off. The bacteria and so if we tried to show you that on a microscope, it wouldn't work, because it would be out in the air and the bacteria would die.
Oh, okay.
The bacteria that we were showing you on the microscope is what is right along the gum line, right under the gum line. So there we're looking for bacteria that could signal that you are at a risk for periodontal disease, which is where you have bacteria in that gum tissue around the teeth. And if it stays there long enough, eventually the bone will start to recede away from that. It'll destroy the gum tissue and then also destroy the bone and supporting structures of the teeth. So what we look at that for is because we want to know, how can we, treat you here in the office? What types of bacteria are we dealing with? Do you have the bacteria that we would normally see? Or do you have the bacteria that is a signal that you are definitely either at risk for periodontal disease or you have active periodontal disease? So that's what we can look at on that microscope, because those tend to be aerobic bacteria, meaning they can function in an oxygenated environment.
But then you also do a biocompatibility too with people, right? Because I think that's what you did when you removed my Mercury. You did a biocompatibility with what you were going to put in replace of that.
Exactly. So yes, we did that blood test so that I knew exactly what your immune system could handle, what materials. So just to back up a little bit, we had when we first started changing the way we practice and we started using biocompatibility tests, we were very limited on the materials that we could use, because there's so many different chemicals and things that go into making either materials for a filling, the bonding agents, cements for crowns, all those things. And so there were so many things that people would react to. So we only had a very small number of materials that we had available. And so that's why when we look on that biocompatibility test, there would be a majority of non-suitables or highly reactives. Now, and this is just another example of how this is patient-driven and market-driven, is now that manufacturers have said, oh, we've got a much bigger market for people that are looking for biocompatible materials. We're going to develop more materials that are biocompatible. So now we have a much broader range of materials that we can use for fillings and crowns, but that also we have to still get back to, okay, but yes, is this particular filling material appropriate for this particular patient? There are times when we have to order something completely different than what we normally use because someone will show up and there's something about that material that they react to.
Isn't that wild?
Is that also true with like partials and things that are removable for people? Is that just as important?
It is. Anything that's going to be in your mouth, touching your tissue, embedded within a tooth, anything like that. There's nothing better than what God gave us. That's obviously the epitome of biocompatibility is self. But when we can't have that, whatever we want to replace it with, we want it to be the next best thing. So anything that goes in the mouth, we have a test on. We can test that to make sure that it is compatible for you and isn't going to cause some other reaction that we would want to avoid.
So what people that may not understand biocompatibility, typically with normal dentists, they'll just place a filling or they'll put mercury or something else without testing. But what you're talking about is whether or not through the blood, you can find out through the blood whether or not your blood actually has an immune system response to particular elements that you're going to use to put in someone's mouth, right? And you can see what they react to, right?
That's correct. The lab that tests that will take the sample and test your serum against that for reactivities, and then we get a big report. You probably saw yours that lists, thousands of dental materials, and then we can look at that and say, okay, you are suitable or not suitable for this material, and then we can make our decisions. Then we can also, once we've looked at that, then we can look at, okay, what's out of these that are suitable, what's the strongest? What's going to look good as well, especially if we're doing anything in the front where your smile is. And we can look at those other things after we make sure that it's going to be something that's biocompatible for you. And I will say, not every patient. We have some patients who they're being proactive. They just have a few fillings maybe they're wanting to replace, and they don't want to go to the additional expense of having a biocompatibility test, but they don't really have any history of immune system issues. They don't have a big long list of allergies or anything that they react to, and they're healthy. And so now that we've been doing this for so long, we've found that there are certain materials that show up on virtually everybody's biocompatibility test as being suitable. So we'll have those materials that we will just go ahead and use on someone that doesn't have a biocompatibility test because we're so confident that they are biocompatible across the board.
Yeah, I was going to ask you about that.
That's interesting because I don't think I had one. So would you, a material like Flexite, is that one of them for most people?
Flexite is great. Yeah, that's cool. One of the best ones for removable appliances. And that's a fairly new material that's become available to us, and that's also, it works great too. Sometimes the problem is something can be biocompatible, but it doesn't work very well.
Oh. It may look good, but
Flexite's a good thing.
You look like you have chiclets in your mouth.
Tiny teeth. I was going to ask you, with going and having two experiences with you guys, it was just incredible. But the thing that I realized, and it wasn't sort of, like a scare tactic from you, but it was just an overall sort of general sense that I got from your office versus any other office was feeling like, wow, your teeth are so much more important for your overall health. And it's so important to make sure that you take good care of them. And so ever since visiting you guys in 2010, I've been taking a hugely active role in taking proactive care of my teeth. And so, like before the show, for example, I had a couple pieces of fruit for breakfast, but I didn't want to do an hour or an hour and 15-minute show with you and have those fruit acids sort of on my teeth the whole time. So I just did a quick brush before the show. But
I'm so impressed.
Yeah, well, you had
he is the king of brushing now.
But when you are talking to people, what's an ideal way for people to take care of their teeth if they have good teeth and they just want to make sure that they keep those teeth? How do you instruct people? Baking soda and what do they brush with and how often and all that?
Mm-hmm. So our ideal brushing protocol, when somebody says, what's the best thing I can use that doesn't have any harsh chemicals in it, that doesn't have abrasives in it. The best thing is what our grandparents use, and that's baking soda and salt with a little hydrogen peroxide. So you can have that concoction in your bathroom in multiple ways. Some patients will make up a little Tupperware or a little glass jar of baking soda and salt, and on our website, Healthy Smiles for Life, it has all this information, and they can go on there and see what this brushing protocol is. And then you can take just a little, dip your toothbrush in some little cap full of hydrogen peroxide and dip back and forth with the baking soda and the peroxide and brush there. I always tell my patients, sometimes people think that sounds a lot more complicated than just having a tube of toothpaste, but I always tell them, if my 20-year-old college son will do this at school, and I walk into his bathroom in his apartment and there's his little tub of baking soda, anybody can do this.
You did something right.
College
That is awesome.
Oh, that is so cool.
That is so cool.
So that's a great, just simple way you avoid the chemicals. There's so many toothpaste out there now with all these promises of all these things they're going to do, but it's because they're adding more chemicals to those toothpaste. And there are some good natural toothpaste on the market, but we've had so many patients that have gone back and forth on, one patient, will have a little reaction to something, and even though another patient loves it. So we've really just started recommending just that baking soda and peroxide. I have had a few patients say they've kind of made it into a paste with a little bit of coconut oil, and then added some essential oils like a little peppermint or things like that to just make it taste a little better, and those things are all great as well. And then asking questions when you do have your teeth clean. Just making sure that they are cleaning below the gum line. Those kind of things. Where if you have a water pick, we recommend that. Tremendous improvement over flossing for a lot of patients, because it flushes out during your home care, flushes out that below the gum line, and does a lot better job than flossing. Because it can get below the gum line a little better than that little piece of string.
So
and you
water
can add some things to the water pick. Some patients just use water, but you can also on our website is mentioned the different recipes that we have, whether it be a dilute solution of hydrogen peroxide, apple cider vinegar. I have a few patients that do a dilute solution of bleach. They feel very clean after they have that dilute solution of bleach, and that's just fine as well. Wow. We used to recommend a dilute solution of iodine, but that tends to make a really big mess. And so we had some patients complaining about their sink being a different color, so we moved away from that.
That's funny. Wow. So I've heard of people doing essential oils on their floss too to get those in between the teeth.
Yes, and that's a great way to do that as well, to incorporate that into your home care. Now,
is the water pick preferable because it can get on the front of the tooth underneath the gum line? Because when you do floss, I have one of those little picks. But when you do a floss, you're just getting in between the teeth. But is a water pick able to get underneath the gum on the front of the tooth, and that's why it's better?
It's better simply because it actually, when you use a piece of floss, that's, flossing is still a very good thing. I'm not telling people not to floss, but a lot of times people say, I don't do it because it's kind of a pain and I can't really get back there very well. Mm-hmm. But also it's just a little piece of string, and you kind of can sometimes push things down below the gum line instead of getting them out. Whereas with a water pick, that stream of water that it's shooting out is gently flushing out below the gum line and flushing things out of the way instead of possibly either missing if there's a little concavity in the tooth or a little angle on the tooth that's hard to reach. The floss just kind of goes straight across that, whereas a water pick's actually going to flush that out.
Wow,
and we've just seen such an improvement in patients that'll change and go home and use that. Usually somebody that's not a very good flosser anyway, they're a lot more compliant because it's easier to use. There's even one, I have one for my daughter, that she uses in the shower. They now make one that is waterproof and cordless, and so you just get in the shower, and she does it, every night when she's in the shower. And for a 13-year-old, that's great because I'm not going to get her to floss.
That is brilliant.
Wow. Do you know particular the brand of that? I'd like to look that up because that looks really interesting.
Oh, you would ask that. I'm trying to remember. I got it at a drugstore.
Okay.
You can also order them online. There's some different ones. There's a Braun. There's an Oral-B. There's different ones. A lot of those toothpaste and toothbrush companies will have one like that.
That is really cool.
So we always tell patients, you go to Walgreens would be our little drugstore that's local. And I say, just go to Walgreens and you don't have to have an expensive one. You just they're usually about $30. It's not a big investment.
I like the sounds of that. I'm going to start doing that because right now I do a lot of flossing and things like that. What I do before bed is, typically between meals, I might use a little bit of toothpaste or I might floss a little bit. But then before bed, I haven't been doing this recently. I need to get back to it. But I'll put a little bit of, I think it's food grade hydrogen peroxide, some salt, and what's the other? Baking soda. Mm-hmm. And then I'll add some water to that and I'll stir it all up about as much as will fit in your mouth to swish around. Mm-hmm. And I'll just brush my teeth without anything. And then I'll rinse my mouth out, and then I'll rinse my mouth out with this sort of concoction. Mm-hmm. And then I leave that on my teeth all night long. Is that good?
Yeah, it's definitely, if you can stand that taste, then yes, that is just fine. That's all good things that you're putting in there. So you're good.
Good. Well, I wanted to get.
I'm very impressed with your protocol.
Yes,
well, thank you.
He's on it.
I'm trying to
encourage me.
Well, I figure people can keep their teeth their whole life, right? They don't have to have dentures and have all their teeth fall out if you keep good oral.
Well, speaking of dentures, Paul in the chat room was mentioning, what about people who don't have teeth? Are they at a disadvantage, people with dentures, for health, or have you come across? I mean, if people are going to have them taken out the right way, is there any reason that they wouldn't be healthy?
No, not necessarily, not at all. They have just a different, they've got a different set of home care suggestions because the tissue now is what we're trying to keep clean. We don't want bacteria sitting under that denture, keeping the denture clean, keeping that tissue healthy. If you have places that are, getting rubbed, you can create little localized infections. We have occasionally had people that maybe had all their teeth out years ago, and they have a physician that's questioning perhaps could they have some pockets of infection in those old extraction sites because they've got some immune system issues or some other health issues that they're not finding any other causes for, and we're wanting to eliminate any infection in that bone as a potential contributor to that. So we do sometimes see a patient that is completely edentulous, has upper and lower dentures, and we'll go in there and check some of those areas to make sure that they don't have any areas that are hidden infections within the bone and those cavitations.
That's interesting. Is that just as important for them to come in yearly or bi-yearly to get checked out like people with full sets of teeth?
I always encourage my patients, if we convert someone to full dentures upper and lower, I like to see them at least once a year, simply so that we can check the tissue, do an oral cancer screening, make sure that they're keeping everything clean. Sometimes we need to go in there and once a year clean the denture itself for them because we've got some other techniques that we can use here in the office with an ultrasonic cleaner to get those dentures nice and clean and don't have bacteria that's collecting in any porous areas of the denture. So yes, I always encourage my patients, even if they have no teeth and they think they don't need me anymore, I still want to see them.
Well, I'm so glad we touched on that because a lot of times we ask questions based off what we have, but there's people listening, that think, oh gosh, I don't have teeth. What do I do about that? So, speaking of not having teeth, while we're wrapping up here, Justin and I are so, last time we were in there, a year and a few odd months ago, talking with Dr. Nunley about possible tooth regeneration from stem cells. What's going on with that these days? Well,
it's still very much in the research phase, but it's so exciting. We have some patients who are really holding out for that to happen and to be approved. I know we're going to see it first in Europe. They are always ahead of us as far as getting things approved and doing the trials with actual people. So you can be watching for that. But that would be our whole goal, would be able to just regenerate from self and be able to just put that back in. And so the research on that is exciting. There's not really anything really new as in the last 6 months or so because it's just still in the development phase. But I know they're working with sheep first, and I'm sure that'll move into some other animals. But yeah, that's on the horizon, and that would just be so exciting to be able to provide that with the patient. Hey, we're going to have to take this tooth out, but we are going to be able to grow you a new one. And so that's exciting that we would be able to replace it with that.
Well, that's hugely exciting. Are they even far enough along in the process of figuring this out, of how long it would take to regrow a tooth? Would it be like a baby cutting a tooth? Would it take that long, or do you think it would possibly take even longer because of, being an adult?
With their research, they're trying all different techniques. I don't think they've given us a time frame yet, but yes, I don't think it would be as long as how it normally takes us to grow them, as they develop, as we're in our first 6 years of life and those kind of things. So,
oh my gosh, it's so exciting.
Yeah, it's very exciting. I did want to, if you don't mind, I wanted to touch on one more thing about the microscope.
Please.
With the bacteria. One of the things that's really important about using the microscope is that there are some times when somebody's mouth is really in bad shape, and we'll do a slide and look at it under the microscope, and we're not really seeing any bacteria. Instead, we're seeing maybe a ton of white blood cells, or we're not really seeing much of anything, but yet their gum tissue looks bad. So then we're starting to say, okay, this patient is not a bacterial cause. We've got to look at nutrition. We've got to look at hormones. And we've even had a few patients that our hygienists have picked up on the fact that they've just got so many white blood cells, and we've sent them for blood work, and it turned out they had something systemic going on, and it was showing up in the mouth before it showed up anywhere else. And so that microscope is one more way that we can individualize that treatment. We don't want to throw a bunch of suggestions to a patient that would work for bacterial infection when that's not their problem. Maybe they're not getting enough nutrients, or their hormones are way out of whack and they need to be seen for that, or it's something more serious systemically that's going on.
Yeah, that's really valuable to make those distinctions. And you're right. I am glad that goes so much levels deeper than, people think, a microscope looking at something. But to be able to kind of be a detective and help people get to the root. No pun intended.
You know what I love about your clinic and your practice there is when we went there and had our work done, you have this acupressure, and there's a whole education that goes on, and it's you never feel rushed, and you just feel like when you walk in, it feels like a big hug. Yeah, you just feel a sense of warmth. Everyone does care about you, and it's just a really warm, nice environment, and very different from the dentist I've grown up going to.
Well, good. Well, that's our goal. So many people have so much anxiety about going to the dentist. We'd really like to make you feel like you're not at the dentist.
Yeah.
And just really bring a comfort to patients, because we really want to do what's very best for the patient. And if you have a lot of anxiety about anything that's going to be going on, that can affect you physically as well. And so if we can lower that anxiousness and just make you feel taken care of, listened to, know that your case is completely individual, it's going to be different than anybody else I saw this week, then a lot of times patients can relax a little bit into that, and then feel comfortable asking questions, getting educated. Our whole goal is to educate our patients on what's going on in their mouth so that they can make the decision about what they want to have done.
Mm. Yeah, it's an amazing practice you guys have going on there. And wow, so people can, if they want to contact you guys, they could just give you guys a call and figure out the whole process from there?
That is correct. We have quite a few very experienced patient coordinators who can answer a lot of questions over the phone. There's also a lot of information on our website for questions that are asked a lot, or the process, the protocol, things like that. But sometimes it's great to just be able to talk to someone and send them an x-ray. Dr. Nunley and I then can look at that x-ray and make a determination of what we're seeing, at least from that view. Things aren't finalized, of course, until we can actually have somebody sitting in front of us and we can visit with them and look at their mouth. But that's the first way to start. Mm.
So awesome. Well, thank you, Dr. Freeman, I think we went a few minutes over. Thanks for spending some time with us and doing the work you do. It's just amazing. Thank you.
Well, I so appreciate you having me, and I just really appreciate you all providing education to so many people. So it's very exciting. Thanks for letting me be a part of it.
Oh, you're so welcome. Hey, hang on the line there really quickly. We're going to close out a live show, and I want to bring something up to you off the air, but I want to thank everyone for joining us in the chat room.
What a fun chat today, guys. Thank you.
A lot of cool people in there, and we do our shows every Friday morning at 9 a.m. Pacific time at extremehealthradio.com. /live. And if you want to join the chat room and make some friends and get your questions answered, we try to do our best to answer all the questions that get put in there, but a lot of times it breaks the flow, and we're trying to make sure that we get a good conversation going with these interviews. So we appreciate you guys being in the chat room and making friends with each other and chatting and having a good time and spreading the word. We appreciate that so much. That's every Friday morning at 9 a.m. Pacific time at extremehealthradio.com /live. And if you'd like to support us and keep the shows commercial free, which is a crazy thing that we're doing here. It makes no sense at all financially, but we want to do the best show we possibly can. We don't want to break up with commercials because we feel like that wouldn't happen in real life, right? If we were just having a conversation.
Yeah. How rude would that be to
break in the middle?
By the way,
buy this product.
Hold that thought, right?
So if you want to support us and buy some of the products that we do promote, you can check them out in our store. We highly recommend that. But I want to thank all you guys for joining us in the chat room. I hope you have a great Friday, great weekend, and join us next Friday again at extremehealthradio.com /live. And if you want to make sure that you don't forget about the Friday shows, you can sign up to our newsletter by texting, let me get this right, Get Healthy to 33444 on your little phone, and you'll be off and running. And thank you, everybody, and we'll catch you guys on the next episode.
Thanks, Dr. Freeman.
All right, Dr. Freeman, have a great day. Have a great Friday and weekend.
All right. Thank you so much. You all too.
Okay,
tell everybody we said hi.
Yes.
Okay.
All right.
Bye.
Bye-bye.
Bye. Well, there you have it.
We have a snoring puppy.
Yeah, she was snoring the whole show.
I think she got a little bit bored about the dental
Hey, she has dental problems, doesn't she?
She has halitosis. That dog. Well, they say dachshunds. I don't know who they are, but I've heard that dachshunds kind of are known for teeth falling out, like losing a lot of teeth. I think it happens with certain breeds, but yeah, I guess it's very important to get your dog's teeth cleaned as well. And Maggie's extra stinky breath lately.
I love her little stinky breath.
Ew. I think she smells. But she's cute, and she hasn't lost any teeth. And you know what? I do have to say it has probably a lot to do with her raw diet and the way that she eats. And she's a pretty holistic dog over there, isn't she?
Oh my gosh,
holistically treated.
Yeah,
I should say.
Hey, so what do you think of that?
Of the interview?
Yeah, it was fun, wasn't it?
I love it. Anything I can learn about teeth, and it's funny because I'm kind of cringing, like over here listening to her talk about, the people having their amalgams taken out the wrong way. And, that was me over 10 years ago. And, but we do what we do, and we deal with the consequences afterward. And I find it really interesting how mercury removal can affect so many people on a lot of levels, or not affect anyone at all. It's just such a, again, I just find like we're all these starfish, we're all completely different, but we kind of look the same on the outside. Right. But once you kind of get in, but my gosh, teeth, it just comes back to teeth being the center of kind of where we start as human beings. It's very strange.
Yeah. It's
health-wise.
It's health. And a lot of people wouldn't put that together, but I think it's really important. I think for me personally, I think the two places that, where most of our health issues come from are probably spiritual, emotional, and your oral pathology. I think those two places are the places to look. Past traumas, earlier on in your life and things like that. I think those can be huge in terms of creating health issues later on in life. People don't even think about this stuff. You
know what I find interesting too is the spiritual, emotional connection with the teeth. Even as we have, like my mom, for example, such a huge, like a stress grinder when she sleeps. She has one of those really? Mouth plates that you put in, mouth guard, I think it's called.
Wow.
Because she just grinds. And I think, wow, sure, there's a physiological aspect to that, but immediately when she starts talking about it, I think, what's going on in your waking life that's causing you to do that in your sleeping life? So I think it's even connected on levels that we'll never even know, as far as the emotional / physical, all completely intertwined even more.
Yeah. It's really fascinating. I think that people need to, one of the things that I forgot to ask Dr. Freeman was, is there a time in people's life that would be beneficial for them to just let their teeth be? Because it's such a burden on the immune system. It seems to me like, someone who's maybe 85 years old and they've got 3 or 4 root canals and 5 or 6 mercury fillings, for them to go through a complete dental revision, it could be too much for them. I should have asked her about that.
Darn, that's a really great question.
Yeah. But I've heard some prominent people say in the alternative health world that if you're up to that age and you're doing as well as you're doing, maybe they're having neurological issues though. If they're having some sort of,
if you have some symptoms that are starting to,
but if they're healthy and they're, mid 80s, late 80s, and they're doing really well and they have all these oral pathology issues, maybe it's better just to
leave them, let
it be and just, bank on the fact that you have just incredibly strong genetics,
I kind of agree with that, but if say you're 85 years old and you start having some, like you said, neurological things, if you didn't deal, it's like you'd want to almost have a human experiment, and I know you can't do that.
Dude, wouldn't that
but
be
you'd
so
want to
cool?
know if you were able at 85 to do all this mouth dental revision and live to be 130
instead of 100
versus 90.
Or 90,
you never know what's going to happen with that kind of a thing. Gosh. I know. Why can't we just clone? Can we ask them to start cloning people after they can work on the stem cell tooth regeneration?
Yeah, let's just clone people.
Let's just clone ourselves.
That'd be the easiest solution.
Because that sounds really not scary.
Yeah, that doesn't sound like Brave New World or anything.
Yeah, right. Okay, Huxley. I have to say that they leave no stone unturned at that office. I was thinking about it when I forget what we were talking about at the end with her there, but I think she was just mentioning that they like people to feel very comfortable and ask questions and do what they can. And they do, honestly, from our experiences there. They do all they can do to put your mind and your body at ease and feel good about it. I remember when Dr. Nunley was trying to put an IV, actually the sweet, I'm not sure. She was the IV starter, I guess, was trying to get me started with my medication to kind of put me in twilight to do my extraction.
Oh, yeah. The conscious sedation.
The conscious sedation, right. And she was having a really hard time with my little tiny veins because I have very small veins. And I was cold and I was somewhat nervous because I'd never had a oral surgery like that before. And so Dr. Nunley, the big guns, came in and he was so great, but they brought me this warm blanket. It was like this one I have wrapped on me right now. It was this fuzzy warm blanket, like straight out of a dryer. And the minute they put that on me, it was like, oh my gosh, it did. It felt like a giant, warm, just soothing hug overcame my whole body and I stopped shaking. Wow. And Dr. Nunley was able to get the IV started. And then before you knew it, the last thing I remember was just him holding my hand and saying a little prayer over me as I drifted off. And then I woke up and I was in an acupressure room and getting an IV vitamin C, and the rest is history. But I thought, wow, having that blanket, I will never forget the biggest difference that made with my whole entire visit there.
I remember he prayed for me too before that was so cool. That was one of the things I remember about that before he did the surgery.
Yeah, you remember that too?
Yeah.
He just said, hey, can I say a prayer for you
if
over
you're
cool with that?
If you're okay with that, yeah. And, some people could be atheists or whatever. But,
sure.
Yeah, that was just so cool,
I remember when we went to Texas to have this procedure done, we had I talked you into staying 2 nights in an Airstream trailer, a vintage Airstream trailer on a horse farm property.
You talked me into that, yeah.
It was a dream of mine, but you said okay. But I have to say, you got the best sleep of your life. That first night you claimed you had the best sleep of your life.
That was incredible. I was pretty surprised, yeah.
Old Airstream. I was
not expecting that.
No, and it was this rickety old Airstream. I thought it was going to be a lot better conditions. But the woman whose property it was on this farm ended up talking to us and bringing us some things that night. And she said, what are you guys out here for the South by Southwest concert?
That's
and we said, no, we're here for the dentist. And she goes, oh, let me guess. Are you going to see Dr. Nunley in Marble Falls?
Dude, and she was like hours away from him.
Hours away.
She was like 2 or 3 hours away.
Probably 2 hours?
Yeah.
And she said she and her husband, but for sure her, had made trips out there to get extensive work done. And I think she had like, if I remember correctly, 4 or 5 root canal teeth done and replaced. I mean, she had this quite a lot going on with her, and she just could not rave on enough about the office. And but
that
I remember
was amazing. What a small world.
What a small world.
Yeah.
What a small world.
She said, "Oh, you got to go see Dr. Nunley."
Mm-hmm.
What the heck?
What the heck?
Yeah.
Yeah. And I remember she came in with her little lantern. It was like dark out in this meadow, and she knocked on the door and came in with this lantern, and we started talking in the middle of the night.
That was pretty crazy.
It was pretty cool. But I remember she said, "Oh, there are angels over there." She goes, "I'm not particularly religious, but I remember that they asked if they could, Dr. Nunley, I think specifically, could pray for her before her procedure going." And she goes, "Yeah, I didn't care because I thought, all good things on my side, no matter what." And she accepted that prayer, and even she had a smile on her face when she said, I had the most magical experience, and I know that there's angels on their side over there. And I thought, wow. And then you walk in the office and you see what she's talking about.
Yeah, they're so warm and welcoming, and
Feels like you're at almost like a bed and breakfast.
Yeah.
It doesn't seem like a dental office.
It's interesting too, because a lot of people may be interested in the conscious sedation. They use something, at least when we were there, they probably still use the same concoction, something called Versed. And it's a
How do you spell that?
It's a sedation. I think it's VERSED.
Okay.
And it's a quick acting sedation that they use, where if someone's having a reaction to something, they can quickly and easily pull you out of that. So if you're having an adverse reaction, maybe to the vitamin C that you're getting or something like that, they can quickly pull you out of that, and it's a conscious thing. So a lot of people have gotten up and gone to the bathroom, after they're on Versed, maybe in the middle of the procedure.
Wow.
So it's pretty unique things that they're using over there.
I feel completely out of it. So I remember when they said you'll be conscious enough if you do have to go to the restroom. I remember thinking, how in the world does anybody?
Yeah.
I mean, wow.
That's pretty cool. I want to let everyone know too that if you're interested in some really great products to take care of your teeth, there are two places that we always refer people to and recommend people go to. One is Living Libations. And the other one is escaping me at the moment. What is it called? They did the Healthy Mouth Summit. What is it called?
Gosh. Why am I blanking?
We'll put a link to the two. There's two great places where Nadine Artemis, who's been on our show, has a whole healthy teeth protocol that she's got some really great products, essential oils and things.
Is it neem oil a big one?
Yeah, neem oil. And so you may want to look at that for natural stuff. Let's see, what is the
Healthy Mouth.
Healthy Mouth
I'm
Summit.
totally blanking. You're going to say it, and I'm going to feel really, really silly.
Healthy Mouth Summit. Yeah, and Will Revek is the guy, and he's really great. It's called Aura Wellness.
There you go.
And the Healthy Mouth Summit is a summit that he put together. Actually, he's still selling that, which I would highly recommend. Dr. Hal Huggins is on that one before he passed away.
Oh, was he?
Yeah, so we'll put a link to the Healthy Mouth Summit if you're interested in listening to all kinds of people talk about tooth decay and this type of thing, as whole body dentistry. And we'll put a link also to his website, Aura Wellness, where he's got all the products too, some really great products. So take a look at the Aura Wellness as well as Nadine Artemis if you're looking for some incredible products to help.
Aura, O-R-A, not oral, right?
Yeah, Aura
Wellness. Yeah, right.
So.
Wow, that flew by.
Flew by, an hour, 25 minutes, just like that.
My gosh.
Just like that.
Just like that.
Pretty cool. So we've got a bunch of people still in the chat room, right?
I think so, yeah. I've been going kind of back and forth with people.
Yeah, so thanks everyone for joining us. We'll put all the links to everything we talked about at extremehealthradio.com/380. And you can check out that show page, and you can get all the links there if you're interested. And anything else to announce? Anything else to talk about? Healthy Smiles for Life. That's Dr. Lane Freeman's website, healthysmilesforlife.com. And what else?
I think there's just to encourage people that there are just small steps you can take to better oral care. And that's what, you and I have added that in. The baking soda is a big thing, the hydrogen peroxide. We didn't touch, though, I think, on Dr. Freeman, talking about making sure that people had their amalgam safely removed and no amalgam left in their mouth, I believe, if you're going to do the hydrogen peroxide.
Oh,
I think that's a very important part of it.
Yes. If you have mercury amalgam fillings, they should really call them mercury and not amalgam or silver fillings.
Right.
Let's be truthful here, people. These are mercury.
They are mercury.
It's a combination of lots of different metals, but if there's mercury in it, let's just call it for what it is. But if they have that, they should not do hydrogen peroxide.
I believe that is the truth. So people might want to do a little bit more poking around research into that.
Yes.
I remember being forewarned as we left Dr. Nelly's office saying, yeah, you guys are good because you've had your mercury taken out. So you're fine to do that. But maybe use caution, obviously, and do a little research before you start dumping hydrogen peroxide in your mouth if you have fillings still.
Well, that was one of the main reasons and motivators for me to go, because I knew that there was some issues with toothpaste and I really wanted to use hydrogen peroxide. I'm glad you brought that up. I wanted to use hydrogen peroxide and baking soda and these the other types of things.
I remember you mentioning this and you knew better. You felt like it wasn't safe, right?
I couldn't do it because I had the fillings in. So, if you guys are interested, I would highly recommend their office just because we've gone there. We've been there twice and we know them personally and we're friends with all of them. And,
both
Carissa,
of them. Excellent.
Yeah, Carissa's amazing. And Dr. Freeman, Dr. Nunley. They're all just incredible people, and Dr. Owens. And, it's worth it to me to put something down like on your credit card and just, it's all fake money. It's all just an illusion, all this monetary stuff that we have going on in our society. It's all fake. And we create money with our signatures. And so this credit thing, if it were me, which is what we did, is put it on credit and pay it off, and you get something fake for something that's real, and the real tangible thing that you get is health and
what we value life more than anything. And by the way, they do accept, like you said, the credit card, the care credit. People can apply for a care credit card, and that's nice. Basically like a medical/dental credit card, and not a lot of places take it. But Dr. Nunley's office is one that does take it, and that's how we were able to do a lot of our work.
Hey, I was going to ask you, we paid for that with the care credit.
The care credit card, and then pay that off over the next 6 months.
We'll put a link to that too. And also, do you know if you were just looking at Carrie Gray's Greensurance, does that cover, if you guys are looking for a holistic, non-Obamacare insurance plan that's non-religious, non-governmental, that is
accepted basically as a private co-op, so you are free from the fine that Obamacare can place on you.
But it's completely holistic and natural alternative therapies. Do you know if
we've been waiting for something like this? I spent a lot of time on there the other day, and I didn't have dental on my mind because we've kind of had ours taken care of lately. I'm not sure.
Okay, we'll put a link to it though.
Yeah, we'll put a link. You guys should definitely check out Greensurance.
We've done an interview with Carrie Gray a while back, and we're trying to see if we can get her back on the show again, seeing if it works out. But she's put together this whole alternative health insurance program that allows you to go get chelation and energy work and body work and all kinds of alternative therapies, Gerson therapies, and it's incredible. So check it out. Greensurance. We'll put a link in the show notes.
Their site's up. I'm on it right now. It's absolutely beautiful, and we can look into this. That would be amazing. Redesign. Most private ones do not go the dental route, so I'm not quite sure. But either way, it's worth looking into for a lot of your health. So.
Or sometimes you pay a little bit extra and you can get dental covered, which would be pretty cool. But either way, with that or care credit, I would highly suggest that you get this taken care of. Look for a biological dentist in your area. And I think, for me personally, and we believe we did this, is we flew from California to Texas because it's so worth it. It's it means so much to us. So I would highly recommend doing that and investing that time, energy, and money into your oral health and getting that cleared up. And then you can start working on the downstreams of your immune system and start working on other symptoms and things. And maybe like with your hand, things will start just disappearing.
It was very surprising to me.
Not to say that you no longer have a hand anymore. Right. I'm seeing the warts on
my finger started disappearing.
It was like Back to the Future. Remember when his finger started
erasing? Yeah, he's being erased.
But it's worth it, right?
I think it's the most worth it thing I've done, and that's why I have to hold my tongue around family members who don't understand, or I try to warn and they don't heed the advice.
You're going to fly to Texas to get your teeth done? What's wrong with you? You're
Once
crazy.
Again, we're the crazy ones, but you know what? I'd rather be crazy and have, the proof's health in the pudding. Yeah. Within a month, they looked at my hand and thought, that is really strange. She's had those growths on her hand for 5 years and they're gone within a month. That doesn't make any sense.
Yeah, we'll put a link to that too.
Let's put a link to the picture.
We have a before. I think we did a before and after.
I did, yeah.
Yeah,
it was pretty wild. Within weeks.
Yeah.
So
cool stuff.
Anyway, you guys, wherever you are in the world, whatever day it is, whatever year it is, we hope that health and wellness are finding their way to you. And if you're looking for them, they most definitely will come your way. So.
Yeah, and if you want to help support us, go to extremehealthradio.com/join. You can bookmark our Amazon link and use that for any purchases. You can donate to us on Patreon. Thank you so much, everyone who's helping us on Patreon. We appreciate that. We have our store that with tons of great products like the saunas, the Qigong courses, the rebounders, the biomat that we use every day, all kinds of really great things, blenders, juicers. Those are all in our store. So make sure if you're ever in the market to go buy something for your health, go to our store first and see if there's anything there that will help you. Those are some ways. And then some free ways are sharing our shows on Facebook and things like that. So we appreciate all you guys helping us out, helping us bring this information to the public and make it more known to the general public about their options for us self-healing. So we appreciate that. And
do we need it more than ever in this day and age, so.
Yeah, so extremehealthradio.com/join is where you can find out how to do that. This was episode 380. For the show notes, extremehealthradio.com/380 We have our show every Friday morning at 9 a.m. Pacific time, extremehealthradio.com/live. Join our email list if you want to stay up to date with all of our shows. Text Get Healthy to 33444. Confirm your email address and we'll send you those bonuses, and then you can never miss a show or an article.
Bring it on.
Bring it on. All right, everyone. Thank you so much for joining us. And
are you going to let me finish it?
I'll let you finish.
We will catch you guys on the next episode.
Hey, everybody. This is Josie, Justin's mum. Don't tell him, but I know he would absolutely be really happy if you would sign up to his free weekly newsletter. And don't forget to share this with all your friends. This is the buzzing bumblebee signing off.
That's so good.
Oh my gosh.
Thank you for listening to this episode.
It's time to go for now, but our mission does not end with this show.
Justin and Kate will be back with another interview packed full of ideas, discoveries, and unique ways to regain your health.
Head on over to extremehealthradio.com/subscribe and instantly download our free gift too that contains cutting-edge strategies to start making healthy lifestyle changes today.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition.